So I am very glad, though, to have an opportunity to introduce many of my old friends, and starting with Minh Zhang, who is the chair of the Department of Global Health and executive director of the Center of Research and Training on Substance Abuse and HIV in Hanoi University in Vietnam. Dr. Zhang is also an adjunct faculty appointment in the Department of Social Medical Science of Mainman School of Public Health at Columbia University, where he is an alumnus. He also contributed to the establishment of the consortium, Southeast Asia Consortium on Gender, Sexuality and Health, that this afternoon we'll have a satellite session here, which I invite you all to attend. Please, Zhang.
Thank you, Leah. So good morning, and welcome to Vietnam to those who come from other countries. And I'm sure that you have heard that before, but I just want to, on this occasion, to welcome you again. I also want to thank Dr. Leah Ciotino and the National Steering Committee, International Steering Committee, for asking me to give this presentation. And I want to congratulate them for putting together a very, very impressive programs of the conference. And it is my real pleasure to be here with you today, especially in the panel. As Dr. Ciotino mentioned, many of the old colleagues that have been working since early 2000. So my presentation today will talk about three issues. One is I will mention briefly the achievements that we have in Vietnam, but I will go more into challenges in reproductive health in general, but in particular in the sexual health for young men who have sex with men in Vietnam. And then I will lastly describe some of the emerging solutions from the community themselves. And I think that's a very important note that I want to end. More importantly, I want to go to the theme of the first sub-theme, and here adding not just the social, cultural, religion, but really the structural, many of the other structural barriers, including the health system itself, that we need to overcome to achieve the no one left behind goal of that we mentioned here. So very quickly, you have read in the program book the achievements of Vietnam. We have reached all of the MDG goals. Especially, we were very at the last in 2015 we achieved the reducing by 2/3 of the maternal mortality. We have kept the HIV epidemic in check in the general population, less than 0.3%. And we achieved that by really expanding the services. For example, 93% of our women are now receiving at least one antenatal checkup, and many of them are receiving actually more than 3 antenatal checkups. Vietnam, in order to achieve that, really a lot of the credit go to the Ministry of Health, where they have established the various guidelines, programs, and policy to ensure the safer environment for reproductive health care, especially for pregnancy care. And here I would like to SES and ethnic minority area. We continue to face with the gender-based violence. The national survey on domestic violence showed that 58% of the women respondents reported that they have at least one form of physical or sexual or emotional violence in their life, and 80%, more than almost 90% of them never seek support from public services, if exist at all. We are now facing the huge issue of gender bias sex selection, with the ratio of boys over girls, 112 over 100, and this will have a huge implication for public health and for social security in the years to come. Cervical cancer is now becoming a leading, I just read recently, the fourth leading causes of death among women in Vietnam. Every year we have about 2,500 women dying of cervical cancer. And the HPV vaccine, although have been proven effectively in Vietnam in some pilot study, yet have been entered into the national health coverage. One of the issues that rarely mentioned at all is the issue of maternal mental health issues. And here we see that mental health issues in Vietnam is a major problem as many other developing countries, but for mothers, they rarely participate in mental health screening because of the lack of knowledge about the issues, but also because of the poor understanding of the mental health issues. Meanwhile, some of the recent surveys show that the very high prevalence of maternal mental health among women in the country, for example, in Ho Chi Minh City, in Hanoi, and in Hue, about 30% of women surveyed had some mental health issues. Very interestingly, one of the studies recently in Da Nang province, among 600 new mothers, found that not being able to rely on their husbands for help, and also having a husband who does not spend time to discuss issues, to discuss the experiences, are major risk factor for depression among new mothers. And then we have the issue of unmet needs in terms of sexual and reproductive health services for young people. And if you look at the unmet need for modern contraception among our married women, about 30%, but it's almost double, 50% among the sexually active young women who are not married. And recently a study, this is a online first study in Ho Chi Minh City by Dr. Tuang so that the young people don't believe in the national health insurance system, and also despite all of the available services, the fears, the fallacies, and fixed social mores are major barriers for young people to access the services that are available out there. So that comes to the challenge that I'm going to go deeper into, is the challenge faced by the young men who have sex with men and transgender in Vietnam. Over the past decade, we have seen a growing visibility of sexual minorities in the country. As you can see here in some of the pictures of the photos of the various activities, from exhibition to Viet Pride to the education in the school and so on. Really, the community of LGBT in Vietnam are really putting together a lot of efforts to make their voice heard. And yet, at the same time, they are faced with many sexual and health issues. This is some of the statistics that show the various prevalence of HIV in different areas in Vietnam. And you see that in major cities like Hanoi and Ho Chi Minh City, the rate as high as 15 to 20% prevalence, HIV prevalence. In a study among 300 transgender women in Ho Chi Minh City, you see that the syphilis, the positive HIV is about 16%, but the syphilis is also a very worrying challenge that they have to face with. And that comes from several reasons. One is the limited access to services. Only 36% of men who are sex with men in Ho Chi Minh City received the STI exam during the past year. That's one snapshot survey. Among men who sell sex to other men in Hanoi, only 4.8% or 19% receiving STI or HIV testing, much lower than the general population of men who have sex with men. And men who sell sex, when they come to health services, they don't want to disclose their sexual relationship with men because of fear of stigma. On top of that is substance abuse and mental health that are the two that are closely linked and really influencing the vulnerability to HIV. We have seen an increasing number of men using various substances, especially the most recently the amphetamine, ecstasy, club drug, and other stimulants. In terms of this is a survey in Ho Chi Minh City in 2014 among 600 men who are suspicious men, and more than 20% of them having depression, and about 10% of them having suicidal thought in the last 2 weeks. That's a very alarming numbers in terms of sexual health. Similarly, among the lesbian women, this is a large online survey of lesbian women in Vietnam, and over 70% of them reported various type of symptoms of mental health disorders, and ranging from experience some days a week to almost every day, and almost every 2 days, and almost every day. So you see that the mental health, both among sexual men who have sex with men and women who have sex with women, is really a major issue. All of that comes to what we are now seeing, have to understand more and more as a syndemic conditions, and how they are related to unsafe sex. A syndemic condition is the term that used to describe how the way in which various conditions like use of alcohol or methamphetamine use, mental health, the low self-esteem, or other, or even childhood sexual abuse experiences, that they are not just only added onto each other, but really working simultaneously, shaping the vulnerability and the risk to HIV and STIs among men who are sex with men and transgender in Vietnam. And this is a study in Ho Chi Minh City among 300 transgender women that I mentioned earlier, to show that the more conditions that you have, the more rates of unsafe sex in the past 30 days that they experience. So this is a very, there's a lot of challenges. So what are some of the major factors that influencing this condition? I want to come to the issue of PrEP. PrEP is now in the demonstration. PrEP, as some of you may know, that PrEP is short for pre-exposure prophylaxis, that you're taking a Truvada pill every day, and that have been proven effective to prevent HIV and so on. So there's a lot of interest on taking PrEP daily in Vietnam. Almost 80%, 90% that transgender women surveyed in Ho Chi Minh City expressed their interest in taking PrEP. But our study, a qualitative study in Ho Chi Minh City, also in Hanoi, showed that there are 3 major barriers. And I would like to emphasize that if you think back to some of the sexual and reproductive health issues that I described earlier, these are also the barriers for the same, some of the same issues. First of all is the issue of diversity. The growing number of men who have sex with men, transgender women, or even men who don't identify them as any of those categories is growing in Vietnam. And I think that our services haven't been able to really understand the complexity and really to tailor the services to meet their needs. And I think that would be the major challenge for PrEP. The second issue is the pervasive societal and internalized stigma that really prevent young men who are sex with men or transgender women reaching to services. And the third one is the issue of health system. And I think that this is a major structural issues that we have to address in the future if we want to really improve the services and expand the services, especially the proven effective like PrEP. So healthcare system, both in terms of the health insurance, in terms of the attitudes of professional providers, and in terms of and other factors really influence the way in which PrEP will be rolled out in the future. So again, these are the 3 issues. If you're looking back in terms of maternal mortality, the young people, sexual and reproductive health, gender-based violence, I think these are all key factors that also influence those challenges. So what are some of the emerging solutions by the community themselves? Here, let me describe some of the really innovative and highly encourage very courageous efforts by the community. First of all, they developed the MSM-friendly services. I'm very happy to report that in Ho Chi Minh City, there are about 3 clinics now that are tailored to MSM. In Hanoi, there's 1 clinic at our university that are serviced for MSM and transgender women. Here, that's the second is the raising awareness of providers. There's a lot of efforts to build, to reach out to providers in the existing healthcare system and raising their awareness, their understanding about the issue about how to work with MSM or with transgender women. Raising community visibility is a major strategy that's showing that our community exists and we care about the health of not only ourselves but also the health of the population. And also raising awareness for the community about various issues that the community faced, not just HIV, not just STI, but also substance abuse, mental health, and many other issues. They have themselves organized the HIV-led testing, the testing that are conducted by community outreach workers who are MSM, who are transgender women, and then to support the services. And also start most recently launching PrEP in Ho Chi Minh City and soon will be in Hanoi. One of the very encouraging signs is that the more and more CBOs, members, participating in international forums like this, not just organized in Vietnam, but also in, for example, in most recent IAS conference in Paris, and 2 CBO members received the award from the IAS for their innovative work to promote the activities in the community. And lastly is the public education to spread information about issues and about the stigma in order to fight against the societal pervasive stigma that I mentioned earlier. So these are some of the, I'd like to mention here 8 innovation, 8 strategy that the CBO, a lot of the CBOs, MSM and transgender women CBOs are now launching and pushing in Vietnam. And I wish that I could see more of those activities applied to other areas of sexual and reproductive health as well, not just among the issues faced by MSM and transgender women. To conclude, so Vietnam we have achieved, made a lot of strides in the sexual and reproductive health achievements, but we are faced with many challenges, not just social, cultural, but also religious, economics, and especially challenges that exist in the health system that are supposed to leave no one behind. And I hope that some of the innovation that I have shown from the MSM and the transgender communities would show us how to move forward in the next decade. Thank you very much for your attention.